Hello doctors, in this video I'll explain the mode of action of amoxicillin, its indications, uses and doses. This will be a brief video. I won't go into too many details, but by the end of it, you'll have the confidence to prescribe this medicine correctly and without any doubts. So the question is, how do we actually kill bacteria? If bacteria are outside on a surface, that's easy. Spray some Dettol and they die. But obviously we can't drink Dettol. So we need a medicine that we can take safely. One that won't harm us but will kill the bacteria. For that, we need to find a difference between human cells and bacterial cells. Something that bacteria have but we don't. One major difference is the cell wall. Human cells don't have a cell wall, but bacteria do. So if we find a way to break down the bacterial cell wall, it's game over. Think of bacteria like a coconut, hard shell on the outside and soft inside. If the shell or cell wall breaks, water rushes in and the bacterium bursts. This is exactly what scientists thought, and they created medicines that can break the bacterial cell wall without damaging human cells. These are called beta-lactam antibiotics. To understand, imagine beta-lactam antibiotics as a prison. Once the bacteria are trapped, their cell wall synthesis is disrupted. The weakened wall breaks down, body fluids rush inside, and eventually the bacterium fills with water and bursts. These include penicillins, cephalosporins, and extended-spectrum drugs like piperacillin-tazobactam. All of them work on the same principle. They break the bacterial cell wall. And once the cell wall is gone, the bacteria can't survive. In the beginning, these antibiotics worked perfectly. But over time, bacteria got smart. They figured out that this prison would catch them and destroy their wall. So they placed little soldiers outside the wall. We call them beta-lactamase enzymes. In simple words, these enzymes attack the beta-lactam ring and make the antibiotic ineffective. To counter this, scientists created beta-lactamase inhibitors like Clavulanate, Tazobactam, and Sulbactam. So now the inhibitors deal with the beta-lactamase enzyme, and the antibiotic is free to do its job, destroy the bacterial cell wall. Now, a quick history. First came penicillin, which was revolutionary, but today it's used only in a few cases. Then came semi-synthetic penicillins. Next were aminopenicillins, smaller molecules that could also work on some gram-negative bacteria. To overcome resistance, we added beta-lactamase inhibitors. And when bacteria like Pseudomonas resisted, we developed extended-spectrum penicillins like piperacillin-tazobactam. Alongside came the cephalosporins with multiple generations. Now let's focus on amoxicillin. It breaks the cell wall, so it works best on gram-positive bacteria. But since it's small, it also works on some gram-negative organisms. So which bacteria does it cover? Mainly Streptococcus and Staphylococcus. These are found on the skin and mucosa. For example, if they are around the nose, they cause nasal infections. Around the mouth, they cause tonsillitis. After a surgical incision, they can infect the wound. Among gram-negatives, it works on E. coli, Salmonella, H. influenzae, and H. pylori. But it does not work on Pseudomonas, Klebsiella, or Acinetobacter. For those, we use piperacillin-tazobactam or higher generation cephalosporins. Clinical indications of amoxicillin. Upper respiratory tract. Bacterial pharyngitis, sinusitis, acute otitis media, peritonsillar abscess, parotitis, and dental infections. Lower respiratory tract. Community-acquired pneumonia, acute exacerbation of COPD, obstetric sepsis, skin and soft tissue, cellulitis, infected bites, preoperative prophylaxis, for caesarean sections or perineal tears after episiotomy. Dosing. Amoxicillin is one of the safest antibiotics. It can be given in pregnancy, in children, in liver dysfunction, and even in kidney dysfunction with just a dose adjustment. Since amoxicillin alone is not very effective, we combine it with a beta-lactamase inhibitor. Tablet Augmentin 625 mg orally 3 times daily, containing 500 mg amoxicillin and the rest clavulanic acid. Injection Augmentin 1.2 grams IV every 8 hours with 1000 mg amoxicillin and 200 mg clavulanic acid. In children, 15 to 20 mg per kilogram twice daily. Side effects. Generally, it's well tolerated, but some patients may develop diarrhea. In such cases, probiotics like Sporlac can be prescribed. Rarely, nausea or vomiting may occur. And that, doctors, is a complete yet simple overview of amoxicillin and its role as a beta-lactam antibiotic.